So this month I'm on my newborn nursery rotation, and one of the biggest things that I have learned till now is what often feels scary to newborn parents is actually completely normal. One of the biggest questions that I hear is, my baby keeps constantly feeding, am I even having enough milk supply? So to answer this, let's understand one thing. What is normal during the first 5 days of life in a newborn? So on day 1, your baby's stomach size is as small as a grape. This is the cherry but for demonstration purposes. So your baby doesn't need a lot of amount of milk. It just needs small amounts, and they'll be getting colostrum, which is your first milk, which is packed with a lot of nutrients and antibodies. Your baby will also be pretty sleepy, so don't be afraid to gently wake them up for feeds. I think you should feed at least 8 times in 24 hours and do a lot of skin to skin contact. Day 2 is what I call a learning day. That means your baby is telling you when the baby is hungry, like lip smacking, bringing their hands to their mouth, rooting, sucking. And crying is often a late sign of hunger cues. The easier that you recognize these signs, it will be easier for you to breastfeed. Day 3, this is what every parent worries about. It's called cluster feeding. This is when your baby wants to nurse over and over again, especially in the evening, and it can get exhausting. And this is when most parents think, am I even making enough milk? So here's the important part. Cluster feeding does not mean that your milk supply is low. It's your baby's natural way of telling your body, hey, make more milk, I need it. Think of it as your baby placing an order for milk for tomorrow. It can be exhausting, but it's completely normal. Day 4 and 5, this is when more of your mature milk starts coming in, and the baby will be more satisfied with hunger. Baby will be able to breastfeed better. They'll have more wet diapers, dirty diapers, and this is where most parents start feeling confident. But of course, if your baby is making less wet diapers, is more difficult to wake up, not able to feed properly and not able to latch properly, please consult your pediatrician, call your lactation team, and they will help you. So if you are in those first few days and wondering, am I even doing this right? Take a deep breath. Your baby is not making your breastfeeding journey more difficult. It is actually the nature's way of telling you that you are doing this correctly. They are following biology, and the first few days can be exhausting, but hang in there, you are doing just fine. And that's our Minute Medicine. Follow along for more tips. And also this month is the breastfeeding awareness month, so all my Minute Medicine videos will be focused on breastfeeding and newborn care. So if you are a new mom or an expecting mom, follow along. We'll answer some of the most commonly asked questions.